Australian Medical Council 2026 AMC MCQ certification exam tips. All you need to know. Question 1. What is the primary purpose of the AMC MCQ exam? To grant specialist registration, to assess medical knowledge for non-specialist practice, to test surgical skills, to issue visas. The AMC MCQ assesses medical knowledge for international medical graduates seeking general registration. Question 2. Which of the following is the first-line treatment for an acute asthma exacerbation? Inhaled corticosteroids, long-acting beta-agonists, short-acting beta-agonists, example salbutamol, oral antibiotics. SABAs provide rapid relief by dilating the airways. Question 3. A 65-year-old male presents with sudden-onset thunderclap headache. What is the most likely diagnosis? Migraine, tension headache, subarachnoid hemorrhage, cluster headache. A thunderclap headache is the classic presentation of a subarachnoid hemorrhage. Question 4. Which screening test is recommended for colorectal cancer in Australia for people aged 50 to 74? Colonoscopy every year. Fecal immunochemical test, FIT, every 2 years. Abdominal X-ray, CT scan. The National Bowel Cancer Screening Program uses the FIT kit every 2 years. Question 5. What is the most common cause of community-acquired pneumonia? Staphylococcus aureus, Streptococcus pneumoniae, Mycoplasma pneumoniae, Legionella. Streptococcus pneumoniae remains the most common causative organism. Question 6. In Australia, which age group is eligible for the shingles, zoster, vaccine under the NIP? Children at 12 months, adults aged 65 and over, only healthcare workers, pregnant women. The Shingrix vaccine is now provided for those 65 plus under the National Immunization Program. Question 7. A patient with a BMI of 32 is classified as normal weight, overweight, obese class 1, underweight. BMI 30.0 to 34.9 is obese class 1. Question 8. What is the defining characteristic of preeclampsia? High blood pressure and proteinuria after 20 weeks gestation, high blood sugar during pregnancy, low hemoglobin, swollen ankles only. Preeclampsia is marked by hypertension and often protein in the urine after 20 weeks. Question 9. Which medication is contraindicated in a patient with a history of anaphylaxis to penicillin? Paracetamol, amoxicillin, metformin, atorvastatin. Amoxicillin is a penicillin derivative. Question 10. The Glasgow-Coma scale (GCS) evaluates which 3 categories? Pulse, respiration, blood pressure, eye, verbal, and motor responses, height, weight, age, reflexes, strength, balance. GCS scores range from 3 to 15 based on these 3 responses. Question 11. What is the first-line pharmacological treatment for type 2 diabetes if lifestyle fails? Insulin, metformin, gliclazide, aspirin. Metformin is the standard first-line agent for T2DM. Question 12. Which vitamin deficiency causes scurvy? Vitamin A, vitamin B12, vitamin C, vitamin D. Vitamin C is essential for collagen synthesis. Deficiency leads to scurvy. Question 13. A patient presents with a strawberry tongue and a sandpaper-like rash. Diagnosis: measles, scarlet fever, chickenpox, mumps. These are classic signs of scarlet fever caused by group A strep. Question 14. What is the gold standard for diagnosing pulmonary embolism? Chest X-ray, ECG, CT pulmonary angiogram, CTPA. Sputum culture. CTPA is the preferred imaging modality to visualize clots in the lungs. Question 15. The rule of nines is used to estimate blood loss, burn surface area, visual acuity, APGAR score. It divides the body into sections of 9% to estimate the percentage of total body surface area, TBSA, burned. Question 16. Which electrolyte abnormality is most likely in a patient on a high dose of furosemide? Hyperkalemia, hypokalemia, hypernatremia, hypercalcemia. Loop diuretics like furosemide increase potassium excretion. Question 17. What is the recommended treatment for a stingray injury in Australia? Ice pack, vinegar, hot water immersion, 45 degrees Celsius, tourniquet. Heat denatures the protein-based venom of stingrays and stonefish. Question 18. A positive McBurney's point tenderness suggests cholecystitis, appendicitis, pancreatitis, renal colic. McBurney's point is located over the appendix. Question 19. Which type of skin cancer is the most lethal? Basal cell carcinoma, squamous cell carcinoma, melanoma, solar keratoses. Melanoma has the highest risk of metastasis and death. Question 20. What does the stand for in the ABCD assessment of an unwell patient? Auscultation, airway, alertness, abdomen. Airway, with C-spine protection, is the first priority.